Hi there. Welcome to the Health Data Ethics Podcast. I'm your host, Jenny Owens, coming to you from a new podcasting platform. I'm going to try out some new features. We're going to try some new stuff. I'm very excited. Please let me know if you like it. I realized a couple weeks ago that I have been doing this podcast for a year. I have 50 episodes under my belt. I've taken a couple breaks here and there, but I thought for this episode, what I really would like to do is do a look back and see where was I at this point last year? What's changed since I first started this particular podcast? And the number one thing that really stuck out to me was my opinions on artificial intelligence in healthcare have undergone a amazing transformation over the past year. So I thought I would summarize what was I worried about last year at this time? And what am I still worried about today? And then in the next episode, I thought I would do a summary of the things that I was really excited about last time and see what's different. What am I excited about today? Let's get started. So last year at this time, I was really worried about artificial intelligence in general, but I was also primarily concerned with artificial intelligence's ability to kind of slurp up large quantities of data without much of a plan for what to do with it. This is a stance that I think was largely born out of ignorance, right? I didn't know a lot about how artificial intelligence was going to be implemented in the healthcare space. And over the past year, as I have gained more understanding of what AI can do in the healthcare space and how AI generally does get implemented in the healthcare environment, I'm less concerned about throwing lots of data into a black box and not being quite sure what we're going to get out, primarily because of all of the people who are like doing good governance, being very thoughtful about the data, helping meet our HIPAA minimum necessary requirements, making sure that we're being thoughtful about the data that we are feeding into algorithms, particularly if the artificial intelligence and the tech is owned by a vendor or company instead of your own healthcare system. So I was very concerned about the exciting ability to share all of our data with somebody else and not know quite what we were getting out of it. I am less concerned about that today. I was a year ago really concerned about throwing data into an artificial intelligence and getting back something that was pretty much the same, but maybe rearranged, maybe presented slightly differently. Maybe it's got different colors. I was really worried about getting back results of minimal value. And I'm not as worried about this today because I have two reasons, really. So one, I am thinking less about every single AI pilot as a judgment on the field as a whole. And two, I am thinking more about every AI pilot more as a measure of potential for what the technology and that relationship with the technology can do in the future. So yes, we may have a tool that is, it's fine, right? Like nobody loves it, nobody hates it. But are we using this to get better at how we bring in artificial intelligence and other innovative tech? Are we using this as a way to familiarize our patients and our providers with this kind of tech? Are we basically using this pilot or this tech that's giving us kind of, medium results as a very low stakes kind of trial run for larger, more ambitious initiatives in the future? So I am less worried about getting results of medium value. I was last year very concerned about privacy and about having ways to opt out if you're a caregiver or a patient. I had a lot of concerns about keeping humans in the loop, right? And once again, I think part of this was born out of a lack of familiarity with what it really looks like to have artificial intelligence and other algorithms of this nature in the healthcare ecosystem. So it's not like you walk into the hospital and tech takes over your care. This is our pilots and the ways that and when I say we, I mean healthcare as a whole, the ways that we're thinking about integrating artificial intelligence into our care are pointwise, right? So we're going to make this particular encounter easier. We're going to make this particular part of your healthcare journey 20% better. So I am less concerned about people having concerns and not being able to find their way out of the system. I am also less concerned about this because over the past year, I've had the ability to participate in some of the conceptualization of some pilots. We've done a lot of really good work about how do you measure, and you all were along with me on that journey. How do you measure the output of an AI? How do you tell if it's doing good things in your hospital system? And I've also had the benefit of working alongside a lot of wonderful, brilliant, caring individuals, all of whom are keeping the individual rights of our patients and our caregivers in the forefront of their minds as well, making sure that patients are notified if their provider is using, like an ambient listening device, making sure that our caregivers do have options available to them if they don't want to have a particular encounter recorded. So I think part of this is due to greater familiarity with what AI means in the healthcare space. Part of it is due to gaining a better understanding of both the governance processes and also the excellent characters of the people that I have the privilege of working with. And I think now would be a great time for me to stop and say thank you to everybody who has listened to me, who has encouraged me in these conversations, who has recommended books or podcasts or articles, or even just agreed to listen to me ramble about something. I really cannot thank you all enough for the encouragement and the help. This has been a really fun journey over the past year, and I'm really excited to see where we go next. So, at the end of one calendar year of thinking about artificial intelligence in healthcare, what am I still worried about? I am still worried about the bias inherent in the system. So I am worried about medical data reflecting our biases of the healthcare field as a whole. And when you feed bias data into an algorithm, the algorithm is going to concentrate and crystallize the bias. And yes, you can get on your hands on some knobs and you can try to like degauss this and like DS that. And I'm mixing my terms here horribly, but you can try to eliminate the bias. But because the data that you're feeding it is already biased, we're never going to get the same results that we would if we had truly objective data, which is a platonic ideal thing that doesn't actually exist. So I am worried about monitoring bias in the system. I am worried about how do we make sure that our algorithms are treating all of our patients as equitably as we possibly can? How do we make sure that our technologies are available, that they are not off-putting to certain populations of patients, of caregivers? When I started this podcast, I have referred to myself as a tinfoil hat, privacy obsessed, extremely conservative person in this space. I'm not, I'm that person still exists inside me. They've been mixed with a heavy dose of like, here's all the cool things that this also can do. So I remain concerned about making sure that people have a chance to get the same quality of care, whether they choose to interact with our technology or not. And I want to make sure that people have the opportunities to deliver the same quality of care, whether they choose to interact with these technologies or not. So an ongoing concern for me. I have concerns about scaling. Let's say you have a pilot, right? And we spent a lot of time this year talking about how do you tell if the pilot is working? How do you measure the impact of a pilot? What can you do? So let's say you've got a pilot and it's gone really well. How do we take that and scale it from just a pilot to full deployment across the enterprise? That's something I'm really looking forward to reading and looking more about. I've got connections at some other healthcare organizations that are doing things on a bigger scale, and I'm really excited to see what they're doing. Which brings me to my last point. Things I'm worried about now that I wasn't worried about at the beginning of this podcast journey. I am worried about being left behind. So not only at my own institution where we are doing work in this space, we are engaged with some really innovative technologies, and I'm really excited to see the directions that we're going. But artificial intelligence in general as a field is moving so quickly, and healthcare is such a very conservative and a regulatorily complex space. We're not really able to keep up. And so I worry that the field is going to move fast, and I worry that we will not be able to take advantage of the good things that this tech can do for our caregivers and for our patients. I worry that our comfort level with certain ways of making sure that we're training our algorithms, our comfort level with making sure that we've got lots of human reinforcement. This is more of a philosophical worry, right? But I worry on our journey, on the journey to generalized artificial intelligence. If we find that reinforcement-based learning is not ideal, because what is that doing if not replicating human cognition and training an algorithm to do essentially what the average human being would do? I worry that healthcare's need to check and recheck things is going to lead to our inability to take advantage of more advanced technology in the future. Obviously, our healthcare's ability to implement technology is going to grow and change over the coming years too, but I am concerned that the field in general is going to kind of take a turn that healthcare will not be able to follow. I cannot thank you enough for listening and asking questions and recommending readings and all of the participating in interviews and all of the wonderful, wonderful community that we have started to build here over the past year. I am so excited to see what the coming years hold for us. Please, if you like the podcast, drop me a line. Let me know what you want to talk about. I thought in the next episode we could talk about things that I'm excited about that have changed over the past year. If there's something else, a paper, a book, a concept, if you want to be interviewed, if there's somebody you think I should interview, let me know. I'd love to hear from you.